Welcome back to Families in Action, brought to you on our hometown station, AM 1220, KHTS. If you're just joining us, May is Mental Health Month, and we are in studio with Bree Bonchet. Correct?
Correct.
Licensed clinical social worker. And before we took our break, we were talking about one of the, a couple of different reasons why people don't seek help for having mental health issues. One being the stigma that's involved in it, and we will talk more as we go on about what we can do to help erase that stigma. And the other one was that people don't know how to identify whether or not they have mental health issues. So we are talking about different ways in which you can check yourself. So on a regular basis, you should be asking yourself these questions. You know, are these things being affected, or am I having trouble in this area of my life? And it may or may not be a sign of mental health issues. The first thing that we talked about, right, Bree, was check your sleep.
Sleep patterns.
You know,
have they changed? Are they different? Are you not falling asleep? The second one is appetite.
Okay.
Changes in appetite. Are you eating less? Are you eating more? A lot of people are emotional eaters, so they'll start eating more and eat the wrong foods.
They call it comfort food,
Comfort
huh? I'm depressed, so give me some mashed potatoes.
Exactly. And your mashed
really?
I don't know about mashed potatoes. I was thinking ice cream, but
or whatever. but they call it comfort food.
Got it.
Because, and that's why they call it that.
Right. Yeah. So if you notice any changes in your appetite, that's definitely a sign something may be going on.
So we're talking about like loss of appetite. I'm just not hungry. I'm just not eating as much. Maybe you're losing weight as a result of that. Or the other side of it, right? Like some binge, maybe binge eat. Yeah, like I'm gorging myself just to try to
when people are depressed and they don't reach out for help or do what they need to feel better, they look for ways to make them feel better.
Exactly.
You know, it could be food, it could be sleep, it could be sex, it could be gambling, it could be anything.
Absolutely. Absolutely.
So sleep and appetite.
Sleep and appetite, tension and anxiety. Are you getting more upset at things that you wouldn't normally get upset at?
Right.
Are you more irritable? Are you flying off the handle? Are you just not, feeling like yourself? That could be a definite sign that something's going on.
So, and a lot of times those signs are, pay attention to your body. Pay attention to whether or not you're grinding your teeth or your fists are clenched,
right.
Or you find like yourself being real sore around the shoulder area, the back area, the neck area, because that's where we hold tension oftentimes, right?
Absolutely.
Headaches, things like that.
Yeah, good point.
Or you're just getting too much anxiety. You walk into a room and something's going on.
Right.
I mean, your body will talk to you. You need to listen.
Yeah.
Right.
And you, like you said, paying attention to, am I normally a pretty relaxed driver, and all of a sudden I find myself like clenching the steering wheel, riding up on somebody's, back of their car, going, "Come on, come on!"
Exactly.
Right?
Exactly.
Yeah. I'm like, oh, what's going on with me right now?
Yeah. Are you yelling at your kids that normally you'd be patient, but all of a sudden you're yelling at them, and what did I do that for?
Or at the office, you're taking it out on people that you work with.
Absolutely.
When I work with a lot of people, it's pretty easy to see when somebody's having hot problems at home.
Right.
Isn't it?
Absolutely.
You could see it in their hole.
Especially if you're working with them on a regular basis.
Exactly.
You
notice the differences.
Yeah.
And then one of the other things is some people like to avoid being by themselves. So if you find yourself not wanting to be by yourself, constantly trying to be with other people, distraction is good. It's not necessarily a bad thing, but if you're really avoiding being by yourself, you're obviously avoiding some kind of emotional issue, because when people are alone, they tend to think about that stuff more.
Right.
So they try to distract themselves by being out, by doing stuff, constantly staying busy, and that could be a sign that people might not normally catch.
Right. Well, a lot of, one of the...
Yeah, you're right. That's a harder one to catch, because most of the time when somebody's depressed, you feel that they're hiding in their bedroom. They don't want to get out of their bed. They're isolated, but getting out in the world, no, that's a rougher, that's a harder one to catch.
So if that's changed, you might want to kind of look at that and consider that, and what's going on. What are you avoiding?
Yeah.
Oftentimes, in the realm of it, in the sort of category of addiction, if you will, one in that category is like a workaholism or staying busy, and the whole reasoning behind that is avoidance. I got to stay so busy that I don't have time to think about the real issues that are going on in my life. It's one of the most difficult of the addictions to treat. because we don't know that we're doing it. We get sort of pats on the back for doing it
Right,
well.
exactly.
It's like, God, you got so much energy and you're so involved, and and you get everything done. But if it is being done to avoid the real issues, then it can be problematic.
Even
Absolutely.
Obsessive working out.
Yes.
It's the same kind of, it looks like really good from the outside, but really it's not. Anything too much, not in moderation.
Yeah, it's almost like if I stop busying myself, then, which is exactly what you're talking about. If I stop busying myself, everything's going to hit me. It's probably a lot of the same phenomena that we see in terms of after the holiday season. Is when we see an increase in mental health admissions, an increase in substance use disorder admissions, because now all the hubbub of the holiday season has died, and we're sitting there with our problems.
Right.
And all the
all the hubbub.
It's all done, right?
Yeah.
Right.
And all our expectations that weren't met.
Right. Get the post-holiday blues.
What still gets me is, you got here 60% of people who have mental illness don't get help.
Yeah.
So it's just kind of, and then you look at the numbers of people that attempt suicide and really hurt themselves, and you think, wow, if those people would have reached out, if somebody might have reached out to them, we might be able to really beat those numbers up, huh?
Right.
Yeah. So just to recap before we go on this break, is sleep, appetite, tension, and busying ourselves, right?
And energy levels. Did I say energy levels? If your energy levels have changed, if you have less energy to do the things that you normally do, or you're not following through on task at work,
Right.
That's an important sign
Right.
to notice.
You just can't. I just don't want to get up. I'm just. Let's talk more about that when we come back from break. This is Families in Action on our hometown station, AM 1220 KHTS.
Welcome back to Families in Action, brought to you on our hometown station, AM 1220 KHTS. If you're just joining us, May is Mental Health Month, and we are talking about checking yourself to see if you might have any symptoms of mental health condition. We've gone over some of the signs, and just to recap on those, we're talking about, is your sleep affected at all? Take a look at your sleep. Your appetite, has that been affected at all? Have you had an increase in your stress level? Are you snappy at people? Are you finding yourself real tense? And then, are you busying yourself inadvertently or otherwise to try to not think about the issues that are going on in your life? And just before the break, we started to talk about concentration, being able to stay on task and things like that. One of the things that we find when we're working with people with mental health issues is that they're sort of all over the place with their thought processes.
Right. And they can't, maybe their job is, performance is sort of declining because they can't stay on task and they can't do the things, can't get, finish up the things that they normally were able to, or they're not able to handle the responsibilities that they normally were able to do.
Right.
So if that's starting to slip, or if, then that's also another sign that there's something going on. And
Your thoughts are not, they're running all over the place. You can't remember words.
yeah, you're forgetful.
Yeah, you're forgetful.
Right.
What's my address? I'm serious. I've asked people, what's your address? And, oh, my God.
Right.
I can't remember.
Absolutely.
Because they're so scattered.
So much on their mind. They're under so much stress.
Right.
And there's a couple more signs that we can look out for as well. One of them was increased use of other substances or behaviors, right?
Right. Alcohol, of course. If you find that you're drinking more than you usually do, or using more nicotine than you do, and any other kind of substance, really, that's obviously a big red flag right there that something's going on. Any kind of increase in those behaviors.
Right. Yeah, I mean, sometimes drug use and alcoholism and things like that are, as just exactly what they look like. Somebody who's trying to get high and it gets out of control. But oftentimes what we find is that there are major underlying issues.
And you know what? And the most prescribed drug in America is benzos.
Yeah,
absolutely.
Over anything.
Yep.
And what is a benzo? It's an anxiety pill. So I guess where I'm going with that is a lot of that really we need to reach out and get some counseling versus masking some of those things with pills.
Right.
Life is stressful and it's challenging. And some of the things that we can do, if you notice any of these signs, it doesn't necessarily mean you have a mental disorder, but it might mean that there's something going on with your mental wellness that you need to kind of get in check early on. So you can try to change your eating habits, decrease sugar intake, decrease your alcohol intake,
caffeine
intake, try to get more sleep, meditate, yoga, exercise, do those things that will hopefully help with the stress.
Right.
You won't need the anti-anxiety medications. And
not that there's anything wrong with it. We're just trying to come up with other things.
Line of defense.
And we want to be careful with any of those kind of medications because they can become addictive.
They can be.
A lot of what we deal with inside of our treatment centers are cross addictions, and many of them are prescription medications that were started inadvertently. Like somebody said, I have an issue.
And that's exactly right. I've been working in treatment now for 30 years, and I'll tell you what, we're treating more accidental addicts today than ever before.
Absolutely.
Because the drugs are a lot more serious, a lot more emotionally and physically addictive. So by accident, we can find ourselves in big trouble. Mm-hmm. So let me ask you something. I know you still have some more of that, but my number still keeps getting me. 60% of people with mental illness don't ask for help. So we know, you go to work, your boss yells at you, you go home, your wife yells at you, your kids say something that hurts your feeling, you're going to get depressed. So there is depression. Everyone has that. And then there's
depression. So basically, if you've suffered a personal loss or some traumatic event, it's normal to feel, depressed or sad. But I guess, when it gets more serious is if that lingers, if the effects really start to linger and they start to impair your functioning at your job, in your relationships, anywhere in any kind of aspect of your life. Now it's headed to more serious diagnosis where you need to seek professional help.
And that, snap out of it doesn't work, does it?
Yeah, well, I'm glad you said that because, as a family member who might be listening to this show, and you're talking about all the signs, and I'm going, like I have a loved one or I have a family member that may be suffering from depression. What are some of the sort of do's and don'ts that I want to do as a loved one?
Okay, I think a lot of loved ones, well-intentioned, will kind of rush in to try to save you and make you feel better and point out all the wonderful things in your life and try to, really kind of pep you up and be your cheerleader. And they're really doing that out of a place of love. But the problem is you shut the person down. And you don't really allow them to tell you what's going on. And really, maybe they're having suicidal thoughts. And if you do that you're not going to get to that. Right. So the best thing to do is...
Yeah, you got such a nice car. You get a beautiful... What's the deal? You got money? Come on.
Why are you depressed?
Right.
Look, your life's better than, this person. So it's better to ask more questions of how can I help? What can I do? What can I do? Can I take you to the doctor? Just ask straight up. Have you had thoughts of hurting yourself?
Right.
You're not going to give them the idea just because you said it.
No.
So.
If the idea is there, it's there.
It's there. So I would ask those questions before you rush in to save them and try to make them feel better about their lives.
So what I'm hearing is, essentially listen to what they have to say and just, don't offer to try to fix anything, but say, look, what can I do to help? And maybe offer some avenues towards more help.
Right.
I have a good therapist. Maybe you want to meet with them, or I can refer you to my psychiatrist, or let's get you to the hospital now, or whatever.
Make the phone calls for them.
Yeah. And by the way, never. I can go over these statistics on suicide again. That number was just alarming. Never take that for granted. If somebody says, I don't feel like living, if somebody says, I'm feeling suicidal, act on it. If you don't and something bad happens, you're going to have to live with that.
Right.
And here in Santa Clarita, we have a lot of avenues that we that are open to us. I mean, you got Henry Mayo Behavioral Health Unit. Henry Mayo's open 365 days a year, every day, 24 hours a day. There's an ER which they can evaluate somebody. You can always dial 911 if you have to. I guess what I'm going with is be proactive. If somebody's saying, I want to die, I'm suicidal, pay attention.
Pay attention, folks. This is Families in Action, brought to you on your hometown station, AM 1220, KHTS.